Hey, what's going on, everybody? We are going to do a quick video on lab number 10, which is the second part of the skull, which is on the facial bones. And they're listed all here for you. The facial bones, there are 14 of them. Notice that only two of them are single bones, the mandible and the vomer. All the other ones, the maxillaries, the palatines, the inferior nasal conchae, the nasals, the lacrimals, and the zygomatics are paired. So we got left and right versions of each of those. So we're going to start with the big one, the jawbone, which is the mandible. We see it right here. We see all the other facial bones in this picture here, making up, of course, the face. And the mandible is going to have 8 key structures we got to know. So there's going to be a body. There's a mental foramen. We know a foramen is a hole. There's going to be an alveolar process. We know a process is a sticky out thing. We're also going to see alveoli, a ramus, an angle, and another pair of processes, the condylar and the coronoid. So let's get started with that mandible. Outlined in red here is the body. Now the body is often, that term is often used to describe the major central portion of a bone, and no exception here. This big chunk of the mandible, which is a U shape, if we kind of hold the entire mandible in our hand, that is the body. We're going to see a couple processes coming off that body, as well as a foramen in it. The foramen in it, which is circled right here, is called the mental foramen. So there's one on each side. The word mental, by the way, means of the chin. So the mental foramen is in the chin region. And it is this hole in the mandible through which blood vessels and a nerve pass, going basically to that lower lip area, that chin area. So that is our mental foramen. Now, right below the teeth, extending upward from the body of the mandible, is a kind of long and slender sticky out piece called the alveolar process. And there are sockets in it, sockets for each individual tooth, and those sockets in the alveolar process are called alveoli. All right, here we've got the ramus of the mandible. So we're coming off the body. We got this extension going up vertically, one on each side. This is a ramus. The word ramus literally means branch, and the rami branch off the body. Notice there is a lot of surface area for muscle attachment, as well as a pair of processes on the superior part. Now, the angle of the mandible is that point at which the body and ramus meet. So when the body takes the turn to become the ramus, that is the angle of the mandible. It's often used as a landmark in dental related fields. Now here we got the posterior process coming off the ramus. It is called the condylar process, also known as the mandibular condyle. So notice it has this rounded projection. The word condyle means knuckle. So someone thought that looked like the knuckle on your fist. And this part is going to come up and articulate with the depression in the temporal bone. That depression is called the mandibular fossa. And this is a movable joint, one of the few movable joints we have in our skull, called the temporomandibular joint. Now, anterior to that condylar process is the coronoid process. And so not quite as rounded because it is not for joint formation. It is instead an attachment point for an important muscle called the temporalis, which is going to elevate the mandible. In other words, pull the jaw shut. Okay. And with that, we are done bone number 1. So that was the mandible. That was the lower jawbone, single bone by itself. We now have a pair of upper jaw bones. They're called the maxillary bones or maxillae. I see them outlined in green here. Notice how they are forming the upper jaw, so they're contributing to the oral cavity, but they also come up, help form the floor of the nasal cavity, the lateral wall of the nasal cavity, as well as the floor of the orbit, and even come all the way up kind of within like the side of the bridge of the nose right there. So pretty extensive bones, pretty big bones that we've got here. And we're going to have 5 key structures on the maxillary bones. Again, because we've got teeth, we're going to have alveoli and an alveolar process, just like we do with the mandible. Plus, we'll have a foramen below the eye called the infraorbital foramen, a palatine process, and a sinus, a maxillary sinus as well. So let's go through all of these, starting with the alveolar process. You find those teeth, and there is a little sticky out ridge just above it. That is the alveolar process. It'll contain the sockets known as the alveoli, which are where the teeth are going to sit. Now, right below the orbit, we have the infraorbital foramen. Of course, the name means hole below the orbit, below the eye, and a vein, artery, and nerve all sneak through that passageway. And of course, 2 maxillae, so we see this hole on each side. All right, what I've done here is flip the skull over to give you an inferior view of it. There's the foramen magnum right there. There's the pterygoids of the sphenoid bone. So we can see the upper teeth here. When we find the upper teeth, we know we're going to find them attached to the maxillary bone. So this is all maxillary bone here. And what I've got here is a fairly extensive structure called the hard palate. So this whole thing I've outlined in blue here is the hard palate. And the hard palate is going to have 4 bones that contribute to it. It's going to have the 2 maxillary bones as well as the 2 palatine bones. So I got 4 bones in my hard palate. I'm going to have a maxillary bone in the front here, another maxillary bone in the front, and then 2 palatine bones in the back here. Now the part of the palatine, of the maxillary bone rather, the part of the maxillary bone that I see right here outlined in red, it is called the palatine process. So this is a palatine process right here. Where I put an M for maxillary bone, another M for maxillary bone. Each of these structures is a palatine process. There is a joint in the middle of the 2 palatine processes, appropriately called the median palatine suture because it's in the middle of the palate. Each palatine process articulates posteriorly with this little chunk of the palatine bone, and this little chunk here, as we'll talk about more in a moment, is called the horizontal plate of the palatine bone. So overall, we've got the bony roof of the mouth, which is the hard palate. Superior, like 80% of it, is made up of the 2 palatine processes, the maxillary bones. The posterior 20% is made up of the 2 horizontal plates of the palatine bones. And we see a median palatine suture that is the joint running down the middle of the hard palate there. All right, good stuff. One more thing with the maxillary bone. So I've taken the maxillary bone out here. Here are the teeth. Here is the alveolar process anchoring it. Here is the palatine process forming that anterior roof of the mouth. Here is the lateral wall of the nasal cavity. And then we've cut part of it away to show you a big cavity within that bone. And that big cavity is the maxillary sinus, biggest sinus we've got. And of course, maxillary sinus, like all sinuses in the skull, are going to primarily function in the production of mucus. And they got a nice mucus-making pseudostratified columnar epithelium in them. In this frontal section here, here is the orbit. Here is the nasal cavity. Oral cavity would be down here. Right here, I've got my palatine process of my maxillary bone. I'm going to have my alveolar process as well, and I see an alveolus in there too. And then this is that lateral nasal wall that the maxillary bone is known for. And then just lateral to it, where I put an X, that is the maxillary sinus, which is going to make mucus. That mucus is going to drain down into the nasal cavity, where of course it helps, filter the air, humidify it, warm it up. All those three big functions. All right, excellent. So we're done with the maxillary bones. We got 3 bones down. We got 11 to go. Now we got the palatine bones. I see both palatine bones here. They look like a forward and a backwards L meeting, kind of like a fancy L meeting right there at that junction. So my 2 palatine bones are going to help form my oral cavity. So the oral cavity would be below them. The nasal cavity would be above them. And they also help form a tiny bit of the orbital cavity on each side. So contributing to 3 cavities. The palatine bone has this vertical part of the fancy L, and then a horizontal part. And it's the horizontal part that we've got to know. That horizontal part is called the horizontal plate of the palatine bone. And we actually saw that a moment ago when we were doing the maxillary bone and looking at the hard palate. So in the same view of the skull here, this inferior view, we've got the bony hard palate here. The bony hard palate has 2 palatine processes of the maxillary bones in the front, and then 2 horizontal plates of the palatine bones in the back. We see one of them outlined in red. And of course, recall that we got that median palatine suture running down the middle. All right, perfect. So we see our palatine bones in all their glory here, maxillary bones as well. Really wanted to show you how the palatine bone contributes to the oral and nasal cavity, but also comes up, and you see this little tannish, goldish guy right there. That is the palatine bone coming up and helping form a little bit of the orbit. And now we're done the palatine bones. We've got 5 bones down, 9 to go. Let's do the inferior nasal conchae. We met the superior and middle nasal conchae. Here is the superior nasal concha. Here is the middle nasal concha. We met those. They were parts of the ethmoid bone. There are another pair of conchae, one of them outlined in green right here. This is an inferior nasal concha. So all the nasal conchae help form my lateral nasal wall. The superior and middle ones are part of the ethmoid bone. The inferior ones are bones unto themselves. They're sitting kind of on the maxillary and palatine bone. So here's the maxillary bone, here's the palatine bone. So they're articulating with those two. The inferior nasal conchae are also seen in the nasal cavity right here, sticking out ever so nicely. And by sticking out, by protruding and kind of swirling a bit, they give us more nasal surface area, which means we can have more mucus for better filtration, warming, and humidifying. They also create some turbulent airflow that is going to slow down the air. It's going to cause the air to spend more time in the nasal cavity, which is also good for filtering, humidifying, and warming. And yeah, that's pretty much it for the nasal conchae. So we're halfway done. We got 7 bones down. Let's do another single bone. This single bone here is the vomer. Recall that there is a bony nasal septum. So I can outline the entire bony nasal septum right here in blue. The bony nasal septum is the posterior part of the nasal septum. Remember, the anterior part was made of hyaline cartilage. And the nasal septum, of course, separates the nasal cavity into left and right halves. And this upper part of the bony nasal septum, we did that last time. That was the perpendicular plate of the ethmoid bone. And the lower portion outlined in green here is the vomer. I also see it in red over here as well. So the vomer articulates with that perpendicular plate of the ethmoid bone superiorly. And then notice that the vomer is sitting on the hard palate inferiorly. So we get the palatine process of the maxillary bone here, as well as the horizontal plate of the palatine bone right there. And so articulating with those two guys, it's our vomer's inferior joints it's making. I do want to backtrack for a second here. I want to show you one more view of the vomer. Let's backtrack for a second. There we go. So if I look at this inferior view of the skull, I can also see the vomer right here. I'm just going to put a line on him. There is the vomer right there. Again, forming that inferior portion of the bony nasal septum. And now we are done 8 bones. Got just a few more facial bones to do, including the nasal bones. So we see here the external nose with a lot of its cartilage, and then right above it, right forming that bridge of the nose, are the 2 nasal bones. We see them in our real skull over here as well, forming that bridge of the nose, articulating above with the frontal bone, and then with a maxillary bone on each side. That's pretty much it for the nasal bones. They're pretty straightforward. So we've got, 10 down, 4 to go in the face. We also see the lacrimal bones in this medial wall of the orbit, the blue guy in my picture right here. So just in front of that orbital plate of the ethmoid bone, just behind that maxillary bone right there. So that is our lacrimal bone. We're going to see a lacrimal fossa in it in a moment. And of course, realize the word lacrimal means related to tears. So in this skull, I can very nicely see my maxillary bone right here, my ethmoid bone right there. There's my frontal bone in the forehead right there. And this guy that the pointer is pointing at, and I am outlining in blue right now, that is the lacrimal bone. So in that medial orbit, and notice there is a nice little hole in it, that is the lacrimal fossa, which is where we're going to find the lacrimal sac, which is the beginning of this passageway called the nasolacrimal duct, which allows tears to drain down from that orbital cavity down into the nasal cavity. So you find that lacrimal fossa, and that is just a great way of finding the lacrimal bone. There is that nice, like inferior and medial passageway right there. Find that hole, you found the lacrimal bone around it. All right, final pair of facial bones are the zygomatic bones, the cheek bones in other words. There they are in blue. Notice they're forming a nice chunk of the orbit. And we'll talk about an important structure on the side view called the temporal process. So let's go ahead and rotate that skull to the side. And here is the zygomatic bone, which I am just going to outline in blue right there. Nice looking zygomatic bone. And this posterior extension right here, this is the temporal process of the zygomatic bone. It is going to meet up with the zygomatic process of the temporal bone. So notice the flip-flop right there. The zygomatic process is on the temporal bone, and the temporal process is on the zygomatic bone. Just take that slowly and it is not going to confuse you. Overall, those two processes, which I see in this nice picture here, create a structure called the zygomatic arch, which is easily palpable on the side of the face. And that is it for the zygomatic bones. Let's quickly go through 6 more bones called the middle ear bones. They are also called the auditory ossicles. Auditory because they're involved in hearing. Ossicles because they are little bones and they're ever so small. These bones, and I see one of them here, one of them here, one of them there. These 3 bones, the malleus, the incus, and the stapes, are tucked away inside the petrous part of the temporal bone. So this is the temporal bone right here. This passageway is the external acoustic or auditory meatus. And this is my petrous part of my temporal bone here. And inside that, I've got my 3 little ear bones. They attach to the eardrum. Sound waves vibrate the eardrum, shake these bones, which shake this little round window in the inner ear, and eventually cause electrical signals to travel to your brain. So that's my malleus, my incus, and my stapes right there in my middle ear cavity. And they are going to help me transmit sound waves. They are known as my auditory ossicles. If I look at the 3 of them separated, I see the malleus. He's got that big, nice, round part right there. Behind him, I've got the incus. Malleus means hammer. Incus means anvil. And this is the stapes, which means stirrup, like what you would put your feet in when you were riding a horse. And with that, we're done with all the bones of our skull, and we are adding one weirdo neck bone as well. This weird neck bone is called the hyoid bone. It's not a skull bone, but it's kind of like, where else are we going to talk about it? Let's talk about it with the skull. So it is a weird bone because it does not form any articulations. So it doesn't attach to any other bones. It does attach to cartilages of the larynx. So we see a big laryngeal cartilage right there. It also anchors tongue and neck muscles. But that is basically it for the hyoid bone. The word hyoid means it's shaped like this kind of Greek letter that looks like that. And you can kind of see that. The hyoid bone does have some stuff on it, but we are not learning any parts of it. We are just learning it overall. And that, folks, is our second video on the skull. Did not take us too long at all. Not nearly as long as the first one, which is excellent for all of us. So on that note, we are done. I will see you next time when we do vertebrae, ribs, and the sternum. Bye-bye.